doubt really complex questions coming up fairly soon. So thank you for giving up your time. Can I have the next slide, Mark, please? So just a little bit about medicines and why they're really important. So medicines are really crucial to improving the health and well-being of our population, and they're the most common therapeutic intervention in the NHS. We've got lots of pharmacy teams across the ICS who enable optimal use of medicines and improving those clinical outcomes for our patients, which is what we're really striving to do, to gain the most benefit we can from the medicines to prevent disease, to reduce symptoms and help people live their best lives. It's really vital that we use the medicines and medical devices that are prescribed, that they're effective products, that they're prescribed, supplied and taken safely by people, and that we have an efficient use of our resources, because obviously there's a limited resource coming into the system and we need to make the best use of those. So just as a little bit of context there, in 1920, we spent £250 million on medicines and appliances within Derbyshire, which is about 14.5% of the Derbyshire pound. Now that does exclude some medicines, because some medicines are nationally commissioned. So some of the really specialised treatments, they're not funded through our local money, and they come through national funding. And just as an interesting fact, the pharmacy workforce, so that's pharmacists and registered technicians, we're the third single largest professional group in the NHS. Can I have the next slide then, please, Mark? So this is just a little slide on our structure within our team, so just the highest level structure. So we're part of the medical director, and we report into the CCG medical director. We have a director of medicines management and clinical policies, and then there are 3 of us who are assistant directors supporting this work. So we've got one assistant director who leads on medicines management and clinical policies and decisions. So their work is leading on policies, guidelines, individual funding requests, all sorts of things about the evidence base for medicines, and making the best policies and decisions around how we use what we recommend to be used within Derbyshire. We then have another assistant director of medicines management who leads on strategy assurance and right care, which is quite a mouthful. All of our titles are really long, I'm afraid. So she leads on the governance corporate aspects of medicines management. So things like some of the medicine safety, controlled drugs regulations, right care, looking at variation where we're different to other areas and whether there are areas where we can improve to improve health outcomes. So within prescribing and other metrics that come through nationally. And then there's my team, so I lead on the medicines optimisation and delivery team. And we have 2 teams within that. So there's the medicines optimisation and delivery team, who is basically mostly made up of pharmacists and technicians, so mostly registered staff. We work with GP practices, PCNs, other stakeholders within the system, looking to prove the quality, safety and cost-effective use of medicines. And then we've also got the repeat prescribing project, which Mark will go on to talk about in more depth, which includes the medicine order line. Next slide then, please. Yeah, so within our team, we do lots of work to try and deliver those outcomes that we're looking to, so around safety, quality and cost-effective use of medicines. So we aim to do things in a proactive way. So we do lots of work around trying to get messages to prescribers before they prescribe. So we've got things like clinical software that helps support prescribers at the point of prescribing, looking at patients' records and triggering appropriate messages for the prescriber when they initiate a prescription. We also do lots of work around searches, clinical systems work to try and promote our formulary and guidance. We also do reactive work, so after an incident or issue, that could be locally or it could be something that's happened nationally. So we put in lots of work to try and prevent those sort of things happening again, so learning from things that go wrong. We do lots of things around communication, so lots of education to prescribers, non-medical prescribers as well as GPs. We do updates, we do networking things, we produce a lot of resources. We deliver annual prescribing reviews and practices to look at the data that they're prescribing and looking at where we might want to look a little deeper to see what's happening and where we might be able to deliver some improvements, and providing lots of updates on information that comes down nationally and locally. And then we obviously support national and local priorities. The last 18 months have been very unusual for all of us, hasn't it? And particularly unusual for us as a team. So we've been doing things that we wouldn't normally do. So we've been doing lots of work in general practice, supporting their capacity whilst they've had to deal with all of the fallout of COVID. We've been implementing some of the national priorities, so they've had priorities around implementing proxy ordering in care homes and other work supporting care homes, so supporting medication reviews in care homes, reviews of new patients who've just been discharged from hospital, or new patients have moved into care homes, and putting in lots of systems around medicines use within care homes. We've continued to promote self-care and use the pandemic as one of the opportunities to try and encourage people to use other alternatives rather than necessarily going to GPs or A&E. So using community pharmacy or having some self-care, having some medicines at home and things to be able to support people at home, you know, some paracetamol or ibuprofen, those sort of things that can help reduce the need to use health services where we can. And obviously we've been really heavily involved in the COVID vaccination programme that has occupied our lives for a very long time, and we've supported it through assurance, setting up, helping with the setup of sites, providing support to the sites across the county, and also physical bodies on the ground. So many of my colleagues within my team have been vaccinating patients or supporting the drawing up and manipulating the vaccines, or also we've had staff on at the Derby Arena site throughout from once it started in January within the pharmacy stores, and we've also been supporting sites across the rest of the county. Normally, in a normal year, we'd be doing a lot more work around value, so work around medication reviews and switches, but that work's been on hold during the pandemic, although obviously the medicine order line is one of our key projects to help reduce waste and deliver effective use of resources in the NHS. Could I just have the next slide, please, Mark? So these are just three sort of headline key priority areas for us. So polypharmacy is a real key national priority. There's been a national task force working on this year to produce some resources that we're expecting to be launched fairly imminently to help review polypharmacy across all organisations in a really systematised way, to reduce any inappropriate polypharmacy. Sometimes people find that they've been started on a medicine, they might have a side effect with it, so they have something else added in, and then they might stop the first medicine, but the second medicine that was started for a side effect might still be left on a patient's record. So it's just trying to make sure that things are reviewed appropriately, that patients know what medicines they're taking and are involved in those decisions around treatment, and having really good conversations around medicines and being really involved in a medication review. Harm, so trying to reduce harm and improving quality and safety is a really key priority area for us and something that we're all really passionate about. We know that there's an estimated 237 million medication errors per year in England, and 66 million of those are potentially clinically significant. So we really do work on things to try and reduce harms and improve safety for patients across the country. And then waste is the last thing. So there's all sorts of examples of waste, but there was a key national audit survey that was done that estimated there was £300 million of NHS prescribed medicines that are wasted each year. And as a result of that, various organisations within the NHS piloted and tried different ways of reducing waste. And within Derbyshire at that time, we were 4 organisations, and we looked at what had been done in other areas, and we started different piloted bits of work to try and reduce waste and see what would work locally for us. So in Chesterfield, we did some work based on work that had happened in Luton, which was around stopping third-party ordering of prescriptions so that patients ordered the medicines they needed, or their carer ordered them, or in some circumstances where someone needs some help, then there were special exemptions put in place so that the pharmacy could order on their behalf. And then in southern Derbyshire, we had a medicine order line that came on board, and that was our first medicine order line that was started, and that was covering Erewash and Derby City and a bit of southern Derbyshire. And that was based on the Coventry model. So that was the telephone line and ordering medicines through that route. And then Hardwick started their project, and in Hardwick, they combined both of those outputs. So they stopped third-party ordering and put in place a telephone call centre, and also did a specific project around stoma and continence appliances and linked in with clinical support to review patients on those products. And then as a result, we've now got the mole, which Mark will now tell you all sorts of things about it. So I'll just hand over now to Mark. Thank you very much.
Hello, hopefully you can hear and see me.
Yeah, we can. Thank you, Mark.
Thank you very much. Yeah, good morning, everybody. My name's Mark Jones. Thank you very much, Kate, for an introduction there. So I'm the business manager for the Medicines Order Line. As Kate mentioned, that's part of the repeat prescription project. So what exactly is the Medicines Order Line? So essentially, we are a call centre environment, and with a team of 75 dedicated call handlers, we process repeat prescription requests sent in by patients of Derbyshire. As you can see from the graphic there, Monday to Friday we operate between the hours of 8 and 4, excluding public holidays. And very similar to GP surgeries, our busiest times are at the beginning of the week. And during these times, there will be an expected call waiting queue. And we aim for about 10 minutes, and we are on the whole around that target. Sometimes we do have spikes depending on the demand, but as you can appreciate, it is the busiest time of the week, and we do openly encourage patients, if they can wait till later on in the week, then there'll be times where, following the greeting message that everybody has to hear and listen to, they will be straight through to a dedicated call handler. So, as Kate rightly mentioned, the Medicines Order Line has been in inception since December of 2017. So from December 2017 up until May of this year, the Medicines Order Line has received just under 1.9 million calls. And for each one of those calls, our dedicated call handlers reviews the request from the patient and makes an intervention. Now, an intervention is preventing medicines being issued, which would essentially have been medicines waste. So obviously, they don't prevent medicines being issued if it's required, and obviously if it falls in line, but we can intervene to prevent and reduce the medicines waste. So out of just short of 1.9 million calls received since December 2017, there's been just short of 1.5 million interventions made. So what does that mean? That would mean that without the Medicines Order Line, just short of 1.5 million medicine repeat requests would have been processed, which would have been calculated as medicines waste. Out of 112 GP surgeries within our region, 70 of which are currently signed up and utilising the Medicines Order Line. So our journey continued. So the graph in the left, hopefully this demonstrates the number of practices that has joined the Medicines Order Line year on year. So anything inside the yellow box is the number of surgeries that have joined the Medicines Order Line. So as you can see, because we started late in 2017, through that financial year up until the end of March 2018, 11 practices joined. And then year on year, we significantly grew by introducing more surgeries to the service. That did pause in 2020, 2021 due to the pandemic, but even with that, we did introduce 6 new surgeries. And since April of this year, we've also introduced 6 new surgeries year to date. And I'll come on to later on in another slide, our plan to roll out further. So you would expect that last year, with only introducing 6 new surgeries throughout Derbyshire, that our calls wouldn't have increased that much. But actually, from this next graphic, it hopefully paints the picture the impact of the pandemic had on the medicines order line. So there was a 95% increase in calls received to the order line against the prior year. And that was predominantly due to the GP surgeries under increasing pressure and obviously capacity there, that a lot of patients were signposted to our service. So this is existing patients whose practices were already signed up to our order line, who then were utilising the service. So that's a bit of where we were 2017 to the beginning of last year. And then this is specifically looking at last year during the pandemic. So if you can remember from the first slide, as I mentioned, since December 2017, we've received 1.9 million calls. 1.1 million of those was actually last financial year, obviously due to the height of the pandemic. At the end of March 2021, the medicines order line was available to a patient population across Derbyshire of 675,000. And out of the 1.1 million calls we received and handled last year, the medicines order line dedicated call handlers made 882,000 interventions. And this equates to £4.1 million savings in the reduction of medicines waste. So what does this mean in terms of difference year on year? Well, as I've mentioned, there was a 95% increase in calls last year from the prior year. We increased our patient population available to utilise the medicines order line to new patients by 12%. 120% increase in interventions made. So this is a 120% increase in where we've actually prevented medicines waste via more patients utilising our service. And this equated to a 37% increase in monetary value. So it was actually a £1.1 million increase last year in savings made. So obviously 1.1 million calls handled throughout the year, which, as it states there, 95% increase in demand to the service. And I just want to really take this opportunity to thank everybody who's utilised our service since inception, but especially for last year, for your patience and understanding. We have significantly grown in terms of our resource from where we were round about between 35 and 40 dedicated call handlers to where we are now. And the entire team is 83. And out of those 83, 77 are dedicated call handlers. So as the pandemic threw many different challenges to us all in different walks of life, it did to us, and we weren't really prepared for the significant increase that over the year it was a 95% increase, but literally overnight, when the first lockdown hit, we saw an immediate 30% spike in demand. And what we did to counter that was go through a very quick and proficient recruitment process to increase our capacity to meet the demand of the patients. So that's all looking in the rear view mirror of what's happened, and there's nothing we can do now or going forward that will change what's happened in the past. But one thing is, what we can do is listen to patients of Derbyshire and stakeholders and what we can do to try and improve our service. You know, essentially we are a service here for patients and GP surgeries, and you are the kind of the voices what can help us to evolve and develop. So as I mentioned, we're not completely now offering our service to the whole population of Derbyshire, and we slowed down due to the pandemic because we just didn't have capacity to do so. But this year we want to get back on track, and our plan is to introduce 26 new surgeries available to the medicines order line this financial year. And that will increase patient inclusion, or patients available to use the service, by 225,000. As you can see in the graphic on the right, at the end of March of this year, we ended the financial year with a population available to use the service, 675. And if we're successful in adding the 26 new practices this year, that will raise to 901,000. So again, a significant increase. And when I say if we are successful, this isn't a mandatory service for GP surgeries to sign up to. It's an option. We present what benefits we can provide in terms of medicines waste, but it's ultimately the decision of the GP surgery whether they want to join the medicines order line. Okay, so the medicines order line via the phone calls, patients call into our services, just one method that patients across Derbyshire can access and request their repeat prescriptions. There are many other methods and we are actively looking to promote these as well. With 25, well, if we are successful, 225,000 new patients available to use our service, this will have obviously increased demand to receive the phone calls of those patients. So where possible, we are looking to promote alternative ordering methods. And I'd just like to reassure and be clear that this is not a mandatory requirement, you know, and ultimately it's the patient's discretion on how they order their repeat prescription via the various methods as what you can see on the screen now. However, any patient that does have access to the internet via a traditional equipment or via a smart device, we want to try and work with patients so they understand that there are alternative ordering methods. One of those is the nationally driven NHS app. And it actually states app, but you can actually visit there via a website. You don't need a smart device to actually access that. And one of the national incentives for the NHS app or website is to really give patient empowerment back to patients so they can take control of their healthcare through the ordering of the repeat prescriptions. But I'd just like to stress, you know, we're not going to a fully online service. Our phone lines are there, but by signposting more people to the app or to the website, if they're able to do so, we'll free up our phone lines for patients who have no other method of ordering. So I just want to reassure, even though we are looking at new technology to improve our service to patients, the phone line aspect is and will remain there. There are some other methods, as you can see, bullet pointed on the left there, such as electronic repeat dispensing, the NHS app, as I've just explained, online ordering through the GP surgeries, and something we are looking to do, and it is only in the early stages, is having an online ordering system via our website, but that's just something that we are looking to scope out in the future. And during the pandemic, we really appreciate that our phone lines were extremely busy. And something that we put in place was a callback service. So anybody who does have access to the internet could email us in and request a callback, and our dedicated staff would do so within 48 hours of that email being received. And that's something that still is in place now. And that is the end of my presentation. Thank you very much for listening, and I think we're going to open up for questions. Is that correct?
Yeah, that's right. Thank you very much, Mark and Kate. I just wanted to, we've had some pre-questions. I'm going to just cover a few of those, and then I'm going to come to you, Bridget, if that's all right, to ask Alison her question. So I'll just do 4 of these pre-questions first. The first one was, it would be helpful to patients who don't have access to the internet or email to perhaps take a different option on the phone system and leave their name and number for a callback if the system is busy. That would then, using this option, would highlight to the operator that it may take more than 3 callbacks as they may not have a mobile phone. Mark, are you happy to take that one?
Yeah, absolutely. And thank you for the question. And it's a valid question. We are continuously looking to how we can evolve and develop our service. So one of the things that we are doing behind the scenes, not only are we delivering the service that we are to patients, but as I mentioned, there's a whole team of 83. 77 of those are dedicated call handlers who will receive and process your repeat prescriptions. The remaining of the team, including myself, we're here to support and look at how we can strategically develop our service. So one of the things that we are looking to do this year is scope out a superior or improved IT and telephony system where there will be options such as this suggested to take into consideration. The current IT and telephony service we've got now does have limitations. So in the short interim term, we won't be able to offer that, but it's something that we are looking to evolve and develop, especially for the next year upon us.
Thank you very much. And Kate, there's one for you here. Can the caller ID be checked back to the patient record?
Yeah, so because patients can ring from any telephone, so you don't have to ring from your home, so you don't have to ring from the number that's registered with your GP practice, then no, we don't check back to match the caller ID to it. It also means if someone's changed their mobile phone number, or if you're on holiday somewhere in England, you can still ring through and order your medicine. So yeah, we don't match it up because that would restrict people's accessibility to use the service.
That's great, Kate. Thank you. And Tracy, could I come to you, please? This also relates to a question that Anna's asked in the chat as well. And it's if one of the items the patient has requested is not due, can this still be ordered if it's within a couple of days?
Yes, thank you for this question. We get asked this quite a lot because sometimes the medications are just slightly out of date. If you've got a 28-day or you've got a 38-day prescription, sometimes they can not be actually at the same time. We've worked really hard to improve our standard operating procedures, and one of our new ones that's come out is that we can actually post-date medications if they're between 8 and 14 days before their next due date. So that's one option that's open for us that we can do for patients. If it's a when required medication, then normally the call handler would ask for some clinical advice because we just need to check on one or two things. So some of you might have already been asked, how many are you taking, how often you are taking, and then we can make a decision and either issue that with the responses that we get from patients, or we will patient request to the surgery so that a supply could be made. And then finally, we're always on the lookout to make sure that we can get alignments done for patients' medication. So if we see at the time that something's not quite gone out of synchronization with each other, then we'll offer that as well at the same time for the patient. So there's kind of three ways that we can deal with that particular situation for patients.
Thank you very much. And Linda, we had a pre-question. This is the last pre-question I'm going to do, if that's okay, because there's quite a lot in the chat. So if a script is needed urgently, so for example, the patient has forgotten to order, can this be processed quickly?
Okay, so good morning, everybody. Yes, we have got the facility. If a patient rings and they need a prescription urgently, we will issue that prescription and flag it to the surgery to let them know that it is an urgent request. We can't guarantee that prescriptions will get processed on the same day. However, we'll say to the patient to give the pharmacy a call later that day to see if it could be pulled down the spine. If it was out of hours and we were closed, for instance, and the patient hadn't called us back to check if it had been signed, then they would call the GP surgery while they're still open. If it's out of hours for the GP surgery, then they could call the 111 service or contact the pharmacy, go along to the local pharmacy to see what could be done for them.
Thank you very much, Linda. Thank you. I'm going to go to you now, Bridget. I believe Alison wanted to ask a question.
Hold on, microphone on. Yeah, hello. Yeah. I've been thinking about deaf people because because obviously they can't call, and I work for a deaf organisation. We have many people who have a lot of trouble trying to get their prescriptions and trying to link with their GP, and it's all about calling. And one person should be sorting it out, one central person for every 14. Hang on. Somebody came in the meeting and went in the middle of the picture. Yeah, okay, right. Go back. You said one person, yeah? And there's one person in 14 days who could sort it out. Their prescription, one person had a problem sorting their prescription out for 14 days. You know, there must be different ways for deaf people to organise repeat prescriptions. That's what we're asking.
Mark, did you want to take that? And Kate, obviously, if any of you want to comment on that, please do.
I think we would really welcome some input and support from you to be able to help us navigate and look at how we can support this moving forward. I mean, obviously there are the other routes if someone can order online and use the NHS app, but that might not be suitable. And we would really value your input and expertise and knowledge on what we could do to accommodate people better and move the service forward. So Alison, is there a way for us to link in yourself with Mark to be able to look at how we better support deaf patients accessing their repeat medicines so that it's better moving forwards for you and everyone else?
Sorry, she's just doing something else. I'm not sure what. She was telling, I think she may be typing something. She was saying that I was freezing. My picture was freezing. So she may have been putting something in the chat.
Shall I take another question, Bridget, and then come back? Is that okay with you? So we've had a question from Sarah. Kate, I'm not sure if we can answer this here. It may be that we have to do it, and we always answer every question. That all answers go on our website, but it's they're interested here about the precautions of medicines, you know, the side effects and whether medicines could perhaps be better balanced with non-invasive methods. I understand that's quite a tricky one here, Kate, but just in case you wanted to put anything in there.
Yeah, I mean, obviously we work with all the evidence-based guidelines and pathways and everything, and there's lots of information available for patients to look at information as well. So there's NHS Choices is a really good website for people to look at and utilise it. So it provides good information on treatment options, and that can really help patients have a look at what the options are when you've had a diagnosis and you know what's going on, and you know, you're living with whatever condition it is, you have the greatest experience and knowledge about how that's affecting you as an individual, and you're best placed to make decisions about your treatment in conjunction with the prescriber and the healthcare professional, having a really good dialogue and conversation around those medical treatment options. And also, you know, often there's lots of things, lifestyle prevention, you know, you can make a real difference around reducing blood pressure by losing weight and exercising more and all of those sort of things. So it's really powerful to have a really good dialogue and look at that information as well. I hope that helps, Sarah, and obviously we can pick up outside if there's something more that you want us to pick up on that.
Thank you very much. There's another one on a similar vein here, Kate, which it's from Michael, and it's, should a new medication be prescribed, should that be in a small quantity, I'm assuming to start with, in case there are side effects or reaction issues to the medicine?
Yeah, I mean, we often do recommend, you know, certainly not starting with a 2-monthly supply, you know, starting with a month as a maximum to try and see if that works. And obviously some medicines you have to titrate upwards to get used to the medicine. It depends on the condition, and some things are very well tolerated and it's not usually a problem, and other medicines require quite close dose alterations for suiting the individual. So those particular medicines we'd obviously recommend really small quantities and review it. Obviously around the workload, if you did really small quantities and had to keep reissuing things, and there's a lot of workload there for the prescribers, the pharmacy dispensing it, etc. So there's a bit of a balance. So we particularly prioritise those medicines that are, you know, there are medicines with narrow therapeutic windows for treatment, and those sort of medicines where we particularly want to use smaller quantities.
Thank you very much. Bridget, I was just going to go back to you. Did you want us to pick up whether Alison would like to perhaps be involved after the session? Is that?
While that last question was going on, I explained that that you'd like to have a dialogue with her, and I think she says she sent an email.
That's really kind, thank you. Richard, would you like to unmute your microphone? Because I know you've got a question that you'd like to ask.
Have I done that? Yes, I have.
That's it, Richard,
Okay.
thank you.
Right, the issue is about blind and speech impaired disabled people who have, well, basically the same problem as deaf people. The difficulty of finding someone to act on your behalf is not that easy, particularly if you have other impairments such as learning difficulty or whatever, and so you're dependent on third-party people acting on your behalf, and with the restrictions and with the care that has to be taken when that happens, this, you know, a little bit concerned about this joined up care structure, but if that's not reflected in the joined up care structure, then somebody is going to suffer, and it's going to be a disabled person. Us healthy, well, reasonably healthy people will probably survive.
Thank you, Richard. So this is about when we move into an integrated care system, whether the landscape might look slightly different in terms of ordering for people who've got additional needs, whatever they might be. Yeah.
Yes.
Yeah, lovely. Thank you.
Katie, would we be able to ask either Linda or Tracy just to explain a little bit about the vulnerable patients and what process we put in place for them, which may be an option for some patients who aren't able to order via the other routes. It won't suit everybody, and we do want to be able to empower patients to order themselves, but it is there as an option. I don't know whether Tracy or Linda want to take it.
I'll take it. Our main option that's open to us, because obviously we can't do face-to-face, we can't see people, we can't kind of interact in that way, is that we have a system in place called mole exemption. And what that can happen is that you can go to your own pharmacy, and your own pharmacy can actually order on your behalf. So you're still in control of all your medication as you have on your repeat system, and you just tick what you want, and then the pharmacy will order through us your medication for you, with the backing of your particular GP. So there is that system in place. That's the main system that we can use for you. We can, if somebody can, and again, it relies on somebody doing it, but if you can use the, get somebody to use the internet and ask for us to call you back, we can call you back and have a chat with you, you know, if you're visually impaired. But I think they're the kind of main two arms that we have to be able to help you in this situation. I don't know if Linda has got any other ideas, but they're the two that I'm certainly aware of with our system.
Thank you very much, Tracy. Linda, did you want to come in there, or do you want me to move on to the next question?
No, Tracy's she's covered that we
that's really kind. Thank you. Joe, I hope I'm pronounced this correctly. I'm going to say Jose. I hope that's the right pronunciation, and many apologies if it isn't. I know you were the next person in the chat, but you've also put your hand up. So if you'd like to ask a question, I'll go over to you if that's okay.
Thank you. It's Josie, actually.
Oh, sorry. Thank you. No sorry.
Problem. Thank you. Yeah, put it in the chat. My GP is a dispensing GP. And the government rule is that if you live less than 1.6 of a mile from a commercial pharmacy, then they can't dispense. So you come out of the surgery, you know, with your prescription in hand, and if Boots is closed or your local pharmacy is closed, you've got to find a way of getting to somewhere like Tesco that's open until 10 o'clock at night. My GP has been very very lenient over the years, but just recently somebody clamped down on it, and now we're stuck. And there are also some of us who actually do like to go into the doctor's surgery and put the little repeat prescription in their box, and then pick up the the piece of paper 3 or 4 days later. I know you've got an agenda, but digital poverty is out there for a lot of people. Thank you.
Thank you,
I've covered 2 questions there.
Thank you very much. Well done. You snuck that one in. Thank you. Mark,
Shall I take that, Katie?
Yeah.
So obviously dispensing practices rules are set nationally, and it's not something that we as a CCG get involved with. It's NHS England who manage the contracts around dispensing practices and the rules and regulations. So they're quite complicated, and I have to say I'm not an expert on them. So if there's a very individual issue, we can look into it outside of the meeting, Josie, because it's there are rules around where you live, whether you're able to be a dispensing patient or not, and which criteria mean that something can be dispensed by the practice for you if you're not a dispensing patient, which are very restricted. So accessing medicines, because obviously dispensing practices tend to be in more rural areas, obviously accessing from a pharmacy can be more challenging. So I completely recognise that. And now I've lost the second part of your question, and I'm so sorry, Josie. What was the second part?
It was about certain people who live in digital poverty. It's digital a big
poverty,
thing at the moment.
Yeah,
because people either can't cope with it or don't have the access.
Yeah, absolutely, Josie. So our medicine order line is one way that people can order. It's not all the ways. As Mark's talked about, we are trying to encourage those that do have digital access that could utilise other methods to be able to release more capacity on the phone for those that don't have alternative ways to order or other ways that aren't convenient for them to use. So yeah, we're very mindful that the medicine order line is one option, but it's not suitable for everyone, because not everyone has the facilities to be able to use the NHS app or those other options, and not everyone's suitable for electronic repeat dispensing, where people are eligible for that. It can work really well for them, but it depends on your medicines and your situation and how stable you are with your clinical condition. But that is another option which doesn't rely on any digital bits for you as a patient, because that's all done by the practice and the prescriptions are all sent to the pharmacy. So electronic repeat dispensing can be something that can work well for patients that don't have any internet access or any digital solutions.
Thank you very much. And Tony's asked a question. What are you doing to reduce waiting times at peak demand? I know you covered a lot of this, Mark, but I'll, you also answered the second bit, which was, is it simply a resource issue that could be increased? I don't know if you just want to cover that again quickly, because you did cover it in your presentation.
Yeah, thank you for the question, and we are continuously reviewing our own performance and looking what that demand will be. And in terms of forecasting, so as the presentation stated, if the 26 surgeries that we plan to bring onto the medicines order line choose to join, then an estimation of 225,000 new patients will be able to access. So obviously it does bring to us some capacity to build into what we can deliver. So yes, there is a threshold with resource, because our peak times are, as it said by the graph there, on a Monday, which is no different to any GP surgery or many GP surgeries across our region and probably across the country. So to have all that resource there at any one time would be a real kind of a staffing challenge to be able to manage that and actually looking at the efficiency of doing so. So what we are looking to do, and we constantly are looking, is to promote the alternative ordering methods, so people who don't have to call during those times can enable and convenient for them to actually use those other options. But we're also looking internally as well in terms of the equipment we've got. We are constantly evaluating our own performance. So We have various different efficiency initiatives, looking at how we can increase our call times, looking at how the processes can be streamlined, looking at continuously improving how we deliver the service. And if we continually do improve the efficiency from our performance, that will reduce call times. But equally as well, as I've mentioned in there, it's the alternative ordering methods, but also making patients of Derbyshire aware that if they can wait to other times in the week and not a Monday, then there will be times from Wednesday onwards. And I do apologise for yesterday if anybody did try to get in touch with our service. There was some significant IT and telephony issues that were outside the CCG's control. So I do apologise for that. But usually Wednesday onwards, once a patient calls the line and have listened to the automatic greeting message, they can, 9 times out of 10, get straight through to a call handler. So it's raising that awareness that if the patient can wait till later in the week, then the call waiting times will be significantly reduced.
Thank you ever so much. We've had a question from Steve, which is there's been a lot of email and mail campaigns from commercial pharmacies like Lloyd's Co-op. Interestingly, Steve, I got one myself from the Co-op yesterday, offering to handle prescription orders, which can cause confusion for some people. Would prescriptions channeled through these commercial routes be subject to the same scrutiny and safety as they would be if they went through MOL?
So when we go live with a practice, we do stop third-party ordering, which includes distance selling pharmacies. So we would ask that pharmacy could order on your behalf, but they'd have to do it via the MOL. And I will just ask Linda to check that I've got that 100% right.
So if you do sign up to one of these third parties, like Pharmacy2, for instance, then your request goes straight through to your GP practice, and then it's the GP practice staff, the reception staff, or the pharmacy prescription clerks there that will deal with those and put them through to the GPs for you. But we don't accept any requests that come through to us at the moment, anyway, from Pharmacy2, and the likes of the Co-op who are trying to sign people up.
Thank you ever so much, Linda. I'm just going to give everyone a 2-minute warning. Rita, I'm coming to you. I'm going through them all in time order. I promise I have to watch the time. I'm very conscious we're not going to be able to answer them all now. So I'm just saying anything that isn't answered here, we will absolutely, it will be. Miriam works very hard, and Kate, Mark, Linda and Tracy will all help so that all your questions will be answered. So Rita, I know you've got a question. I'm sorry, you've waited patiently. I'm doing it in time order. Would you like to ask a question? You need to unmute, Rita. Just unmute. That's
right.
It.
Well, to tell you the truth, it's not actually a question. It's what a wonderful service you are supplying.
Oh.
I went on the phone first for a couple of orders, and it worked beautifully, and that you've got some lovely people there. They didn't rush me at all. They were marvelous. But now I'm online, and it's absolutely perfect. Thank you so much. The only thing is that when you talk about hoarding drugs, I keep 1 month's extra supply of all my drugs. I'm a diabetic, and things can go wrong. Sometimes it has happened in the past, so it's a bit worrying, and that is why I keep that. But otherwise, thank you so much for your service.
Thank you ever so much, Rita. I'm sure that's lovely for the team to hear, and we'll obviously forget you've said that you're hoarding the drugs, because that's a big no-no. Okay, so I'm going to move on to Steve. He said, Mark, could you very quickly say what is your definition of waste and what's the definition of an intervention?
Yes, so definition of waste is obviously any repeat medication that has been issued that that shouldn't have been issued, essentially, in very simplistic terms. So in terms of how we intervene by a call handler, taking that request. We will have intervened from a third party ordering That's the biggest kind of waste reduction we've seen from third-party ordering. But then we can also intervene by preventing patients ordering early. And what that is obviously trying to do is to prevent the hoarding, so to speak, of medication.
All right, because Steve was saying it seems to be targeted on reducing waste rather than providing an efficient service. But I think you've covered that element, haven't you, when you've talked about the way the service has responded. Mark, unless you want to just add another brief.
No, I think obviously last year for everybody in every walk of life, you know, the pandemic, you know, caused us a lot of challenges. So with the impact of the 95% increase in calls, we were under, you know, increased pressure to deliver that service, as everybody was, you know, across the NHS. And again, I just want to thank everybody for their patience and understanding. But yes, so it is a fine line between delivering the patient's service that we want to and being able to meet the demand. Our call handlers would love to stay on the phone for a 15-minute conversation to really get to know the patient, but as you can you know, appreciate, by doing so, the demand would you know, we would have a lot more upset patients who can't get through to the service.
Oh, and we've had a question from Michelle. How do you approach GP surgeries to join the MOL, and do you have surgeries you wish to target?
Absolutely. So my background, for anybody who's interested, is not healthcare, but it's more from business management. So what I'm bringing to the team is that commercial aspect of how we can, for using your own terminology, target outstanding practices. So we do have an aspiration that every available practice, so obviously non-dispensing practices are unavailable at this time to join. We do have an aspiration, and we would like to welcome each and every practice. So I personally reach out to all the outstanding practices not there, explaining what we do and the benefits to them, and obviously to reducing the prescribing waste. And then really it's down to that surgery to discuss amongst themselves and get back to me if they do feel it's something they would like to pursue. What I would say is I reach out by email, and if I don't get a response, I do continue to reach out to try and get a response, just so we can understand whether that surgery wants to join or not. And if they don't, then we will obviously move on to other surgeries who may want to.
Thank you very much. Now we've got two questions relating to the app. One is the app the same one that's responsible for the pingdemic, currently causing big problems? And Sarah's asked, how does the app support the prevention and going ahead with repeat prescription, with the repeat description? I think that might mean repeat prescription. Yeah. Yeah.
So it's a separate app to the track and trace app. So it was in place before the track and trace app was there, obviously on the back of the pandemic. So I'm not an IT guru by any stretch, but I do know it is a separate app. And I personally use the NHS app, and it works for me. It might not work for everybody, but I do see the value in it for me personally speaking. And in terms, how does that work? So any patient that is requesting a repeat prescription via the NHS app, that will then go straight through to the GP surgery, and the GP surgery will process that. There are ways, and what we're trying to look at, and it's all about how we strategically evolve and develop, how we can obviously intervene. But at this point in time, we don't have the ability to make those interventions. It goes straight through to the admin team at GP surgeries.
Thank you ever so much. Jocelyn, I know you've got your hand up. I'm sorry, I'm doing them in time order. Would you like to ask a question?
Yes. I first became aware of the MOL 2-3 years ago when you were just starting out, and a presentation was done to the engagement committee. And then there was a problem in that it was only really available for surgeries that use System 1. And if you used EMIS, there was very limited availability. I know work has been going on, but I was just wondering how that has progressed and whether the MOL is now widely available to surgeries that use EMIS, not System 1.
Yeah, thank you for your question, Jocelyn. Yeah, I am pleased to announce that we do now have capability for EMIS clinical practice, clinical system practices to join our service, and that was something that we were working on behind the scenes throughout the pandemic, and as of June this year, that is a fix that we do now have in place. And as from the 4th of August, throughout August, there are 5 new surgeries joining the Medicines Order line who are all EMIS practices. And myself and Tracy have also spoke to a number of other EMIS using practices in the south of Derbyshire who have expressed an interest to join our service. So yeah, in a nutshell, it's not limited to just System 1 now.
That's brilliant. So as a chairman of a PPG, I can lobby my practice to join you.
Please do.
Yeah.
Right, I just want to say, I'm sorry, I think there are some more questions in the chat box, and I absolutely apologise if we've not got to them. As I've said before, all the questions, Miriam uploads this session onto YouTube, and all the questions appear as question and answers, and they'll all be on there. I'd like to take the opportunity to thank Kate and Mark and Tracy and Linda for joining us today, because I'm sure, as we all are, that everyone's very busy. But more than that, I'd like to thank you for joining us today on this incredibly hot day and giving time out of your day to join us. We absolutely appreciate it, because I can see there's a big temptation after last week and rain to think, no, I want to make the most of the sun. So thank you for that. I just want to say, in terms of the dialogue, we are having a break for August, and I know you'll be devastated to hear that, but we are going to have a break, because we think, and then we will be planning the sessions to go on from September, which will be a year since the first one. So please, if there are any sessions that any of you feel that would be really, because the mole session today came for request that one of that Anne, as one person, made to us about, she'd be really interested to hear more about it. So as we have responded to that, if there is anything where you think this would be a really useful topic for people to know more about, then please email us when Miriam sends the evaluation forms and things out, and please let us know, and we'll look to put that into an agenda for September onwards, because we're always happy, and obviously Miriam and I think of the things that we think, but it's much more important that we hear from the things that you want. So thank you again, everybody, for joining. I hope you found it useful. Thank you so much to our presenters. And also, I'd like to give a special thanks to Bridget, and we'll make sure